Hello everyone. My name is Bill Romero of class 1981. 1981 is proud of Menchik Padilla, class 1981. Then you have Associate Dean Armand Crisostomo, and then your anatomy professors, Pio de la Porta, and Randy Abdullah, and then Arifel, Jerry Hernando, and a lot of class 81. But anyway, today I'm going to convince you that all you need really to be healthy is Botox. I'm going to prove it to you. I'm going to prove it to you. Just give me a chance. All right. Anyway, I won't blame you to take out your mirrors and look at yourself while I'm talking. Anyway, my practice is cosmetic medicine, and I practice on Long Island. And cosmetic medicine is a new field. It's not even AMA recognized it. We are beauty physicians. We are a cross between dermatologists and plastic surgeons. All we do are inject Botox, inject dermal fillers, and make our patients feel better. I want to disclose that I'm a trainer for Allergan, the makers of Botox, and Jupiter, and Hybella. And I receive monetary compensation from them. Aha! Celebrity IQ. Who's on the board? Come on, guys. Who's on the board? Okay, if that's J-Lo, who is this? Come on, guys. Okay, if that's J-Lo, who is this? Okay, so we have learned how to sculpt faces. Actually, there's no surgery except reportedly nasal surgery on J-Lo. But everything else is Botox and dermal fillers. Notice that the angle of the jaw on the first picture is very soft. You see that? And then it gets better on the second photo, and then it even gets better on the third photo. So, okay, but the question is, if you look like, if J-Lo looks like the first photo, who's gonna hire her? See, everybody says, I want to look natural, I want to look natural. Unfortunately, nobody's gonna hire you when you look natural. That's Joan Chen of ABC. She was criticized because she has changed her face so much. But if you're in the business, you have to look like you're in the business. So, anyway, studies are very, very early. In fact, I can only find one established study that says, well, the study is very simple. They took 30 patients, they divided them into a treatment group. They divided them into a treatment group and a placebo group. At the end of the study, well, these are treatment-resistant depressed patients, remember. They're being treated, but they are not responding to their medications. So they tried Botox on these patients. And half, 47.1% of the treatment group, and then 9.2% of the placebo group had better results with uplifted with their depression. So it was a significant study that says the way you look is the way you feel. And of course, at the end of the study, the results were even more significant. Now, you know that your study is very, very early if you can only find 5 studies for your meta-analysis, right? So, but anyway, there were 5 studies that were gathered into meta-analysis, which again, prove that when you look better, you feel better. So, these are actually my patients. The effect of Botox is almost magical. You inject it on the forehead, and that forehead just smoothens. Right? So, but then again, not everybody wants to look like that. But for those people who would like to look smoother, Botox might be a temporary, cure for their what you call sadness because of their concern about how they look. Now, this is the same patient. Again, almost magical. When you put Botox appropriately, there is a sense of relaxation on the face of that patient, right? No surgery, it's just Botox here, not even fillers. And of course, The panel on the right, is that right? Yes, my right. They look angry. They look masungit, right? But when after Botox, they look nicer and they look more approachable. And a lot of people go for Botox because of that. In fact, they feel sad, and they tell me they feel sad when the lines start coming back. And they say, Dr. Romero, I know that it's time to come back when my students, if they were a teacher, are telling me, Mrs. Smith or something, are you angry with us? So it's almost time to go back to Dr. Romero again. And sometimes, you know, Botox has to be compensated or even augmented with a dermal filler. Botox sometimes doesn't work very well because the dents have been there for so long. So they create a fissure on the glabellar complex. In fact, as early as 17, 18, early 20s, late 20s, a lot of patients are coming now for Botox injections because they're trying to prevent the fissure that occurs or the dents that occur on the face. So this lady in particular, we tried Botox, I tried Botox. She was still upset about her fissures on her glabellar complex, and I had to inject a dermal filler. Now, actually, cosmetic medicine is basically knowledge of anatomy. The muscles are so thin, and they're so, you know, you have to inject the right muscle, otherwise you get the opposite effect, right? So for example, this gentleman complained of frontal lines. This is an example of an overcorrection of lines. So what happens is when we lift our eyebrows, your frontalis muscles are pulling your eyebrows up, but in the process, it's corrugating your frontalis, in your forehead. But when you over-inject that frontalis muscle, what happens is there's no strength to lift your eyebrows. So it's not a droop, but rather an inability to lift your eyebrows. So at this point, in that picture, he was trying to lift his eyebrows, and they won't lift anymore. And sometimes patients would complain, Dr. Romero, I can even put you know, my makeup on my upper eyelid because, you know, but sometimes in the beginning you have to estimate how much Botox you need. And if that was too strong, so the next treatment you have to adjust it lower. Everybody has different concerns. Some people are concerned about their neck muscles, you know, they want to wear their you know, pearl of necklace of pearls. And of course, they want a smoother looking neck, and so we can inject the platysma muscles on the neck, and it will smoothen the neck. But that's of course only temporary. Botox only lasts 3 to 4 months. A lot of people come by event, you know, they have a wedding or a reunion, homecoming. How many of their classmates are coming with Botox? I don't know. But I'm sure some of them had Botox. So those people who all of a sudden look about 10 years younger, you might want to ask them. Okay, so complementary to Botox are the dermal fillers. And the principle is this. In 2008, Time magazine recognized that cosmetic medicine was becoming more popular. So they presented how one can look so much younger. And the principle is this. The face of a woman to look younger and more feminine has to have a triangular shape, which means the middle of the face has to be wider than the lower part of the face. So you have to have a triangular face. Now, what makes it triangular is very simple. It's the cheeks. So once you lose your cheeks, then you're becoming less triangular and you're getting more squarish. When you're getting more squarish, it means you have a jowl, you have a nasolabial fold, and a marionette line. And that is simply corrected by injecting dermal fillers on the maxillary area, malar areas of the face, thereby lifting the cheeks away from the center. So by gravity, our face moves forward. So then you become you look older. But when you inject dermal fillers along this way, and if you look at Jennifer Lopez and the Kardashians, then you will see that their cheek not only is in from the front, but it goes all the way to the back. And that serves a purpose because by doing that, it's pulling the face to the back. Alright? So that diminishes your nasolabial fold, it lifts your marionette lines, and if that's not enough, you will see that they will also pull the face forward, backwards by injecting dermal fillers on the angle of the jaw, which is what we call jawline contouring. Alright? So, if you see Eva Longoria and Jennifer Gray was 55 when this picture was taken. She had surgery, but surgery is not enough. Because surgery only tightens your face. It doesn't reshape it. So then you have to reshape that face with dermal fillers. This patient came to me about a year ago, and she was complaining of her dermal nasolabial folds and marionette lines. The mistake you can make is to inject dermal nasolabial folds and marionette lines. Why? Because that face is going to become pointed looking. See, the defect is not in the front. The defect is on the lower jaw. Lower cheek. Do you see that? Right. So if you make a mistake of injecting more in here, then you're pulling that face forward. Rather, you want to pull that face backwards by injecting on the lower cheeks. You see that? If you see that, what about this? Okay, so basically cosmetic medicine is an analysis of how you can make your patients look younger. And we have advanced to the stage where we can almost inject a lot of areas of the face. What happens also is on the forehead, from a round, smooth forehead, we will create a horizontal furrow on the forehead. When you lose your fat on the forehead, you don't know that when you were babies, you had fat on your forehead until maybe 17, 18 years old. So you had smooth foreheads. But as we lose the fat in our foreheads, it's going to create a furrow. And by loosening the forehead, then your eyebrows are going to droop. So one trick we do is we put fillers on the forehead to make it round and smooth again, and it pulls your eyebrows up. Not only that, if you look at some people's temples, they are sunken, right? So if the sunken temple actually allows the skin to move forward, and it's going to cover your eye. So if you put fillers on the temples, then that's another trick. So we have glabellar lines, male enhancement, cheek augmentations, all of these dotted lines we can start correcting with dermal fillers. But then again, there are dermal fillers for each part. For example, along the jugular line, you have the voluma line, which was designed for the cheeks. We have the jugular ultra plus for the nasolabial folds, and you have the jugular ultra for smoker's lines. They last about a year, and voluma is rated to last about 2 years. And because voluma is the latest of the products where the molecular adhesion is better. Now, the model on your right, on your left, is 24, it was 24 years old, and Brooke Shields was 44 at that time. But you can make Brooke Shields look like the 24 if you would just cover her glabellar complex, if you would just cover her nasolabial fold, and if you would just cover her cheeks. But then again, you know, she wanted to look natural. Dermal fillers, on your left, 20 years old, on your right, 49 years old. The magic of dermal fillers, you can make them look very, very much younger. You see the difference? The middle picture is actually 1 year after the picture on your right. Well, the latest, of course, just recently is Tibella. Actually, we've been using deoxycholic acid for a long time until a doctor decided to patent it and named it Tibella. So Tibella is an injection. Deoxycholic acid is a fat dissolver. So if you inject it in the appropriate areas, you can dissolve, the turkey neck on the appropriate patients. Well, again, you can say, my God, that's just that's not much. But what is insignificant to one person can be very significant to another person, right? So life is what we make it. Two bombshells of the 70s, Sophie Loren and Bridget Bardot, went their own dichotomous paths. One took care of herself, and the other one not so much. But Bridget Bardot is an activist. She doesn't want to use anything that has been tested on animals, so she doesn't use any makeup, she doesn't use anything. Well, that's her choice. But again, life is what you make it. We don't really know why Botox was able to uplift the spirits of those depressed patients in the treatment study. All we know, we feel better when we look good. Even when you're sick, you just take a shower and comb your hair and then make your bed and you feel better. When your car is car washed, you feel better. But that's how we are. So, we feel good when we look good. Beauty is in the beholder. I hope we don't overdo our, our beauty stuff. So, have I proven that Botox is all you need? Thank you very much. I can clarify some things for you if you want.
How about laser? It's very well...
Oh yes, laser. Well, laser is part of our cosmetic armamentarium. Laser is becoming less and less popular because there are things that we can do that are not as intensive and not as expensive. For example, we have chemical peels that are almost as effective as dermal fillers, as lasers. We know that the strongest chemical peel is made up of phenol. Combine that with PCA, then you have one of the most popular chemical peels now, which is high-peel. But going back to your question, laser we use for laser resurfacing, so you can remove fine lines, you can remove pigmentations, you can remove telangiectasias on the face. But I stopped using laser because a lot of people are using laser now, and I'd rather focus on the injectables. All right, that's it. Your last chance. Okay, thank you very much.